Hi, I'm Dr. Gerald Evans, and this is your 101 for today. All right, so one of the questions we get asked is, are the COVID-19 vaccines effective? Do they actually have an impact? So let's look at that. What we know is that they do reduce a number of really important outcomes that are associated with COVID-19, and they're very effective at doing that. If you look at their reduction in the chance of severe illness or hospitalization, it's somewhere near 90 to 95% when compared to people who are not vaccinated. If you look at the reduction in the chance of dying, it's very high, and it really is at about 99%. So the reduction in the chance of dying from COVID-19 is markedly reduced if you've been fully vaccinated. And very interestingly, the chances of even being infected at all is actually reduced by 60%, which is actually quite impressive, and it's the kind of thing that most people look at. And that means if you can't be infected, you can't go on and transmit the virus either, so that's important. If we look at sort of overall effectiveness, this is from a very recent study that was just published in the New England Journal of Medicine, and it looked at vaccine efficacy against severe disease in the y-axis here, and then vaccine efficacy against any infection. And they looked at a large number of reports. Most of the reports suggested that, the vaccine effectiveness at preventing severe disease was very high. And when you look at its reduction in the any infection at all, it was down around 60 to 70%. And some of the other studies, those rates were even higher. If you look at it, looking at variants in the top right hand here, you can see that alpha was the virus that you were most protected against with these vaccines, but Delta is really close by, and I'm going to show you another graph in a second that reinforces that. If you look at the platforms, the mRNA vaccines look the best. The vector vaccines were pretty good. And even the inactivated virus vaccines, which were used and produced primarily in China, were relatively effective. Protein subunit vaccines are not available, but they're looking quite awesome, and we're really looking forward to seeing what those trials show. And really, there was no difference in whether or not you looked at that vaccine efficacy from early after people were vaccinated to later after people were vaccinated. So this is really a big general graph that shows you when it comes to alpha and delta, these vaccines are enormously effective once you have 2 doses or are fully vaccinated. With the mRNA vaccines, this is Pfizer here, looking a little better than the adenovirus vector vaccines like AstraZeneca, but they also provided enormous protection. When we look at it in terms of outcomes, it's very easy to see the signal here. This is data from Canada, from PHAC, looking at unvaccinated people in gray, and then people who were either partially or fully vaccinated in dark green. And you can see here that you can barely see the signal for either a case, a hospitalization, or death in people who are fully vaccinated. The same can be seen here in Ontario, where we've looked at that, where we've looked at similar rates of cases, hospitalizations, and being in ICU. And you can see here in orange, unvaccinated individuals have a much higher rate of infections when you compare them to people who are fully vaccinated. Fully vaccinated people are basically flatlined down here in terms of the incidence over time through August, when we were seeing a rise in infections with Delta. So really, what we're seeing here is that the vaccines are enormously effective at preventing hospitalization, severe illness, and most importantly, death. And of course, the big advantage of reducing infections in total, which will result in a reduction in transmission. So yeah, these are good vaccines. They're very effective.